Joy
Thank thee
99.7
for thy
FM.
love so pure and free, O Lord. We thank thee.
Yes, we thank thee every day. And I played that in honor of the late
That blooms.
Kofi Annan. May he rest in peace. Back to Ultimate Health on Joy 99.7 FM, brought to you by Yumvita, a delicious way to grow. Last week we had the honor of having Dr. Paul Enin of the Airport Women's Hospital with us in the studio to discuss fibroids, uterine fibroids. Today he's back with us to finish the job. We didn't quite complete that. Note also that he's also the director at the E&E Medical Center and Woman 360 Clinic in Adenta in the E&E building. So last week we learned a lot, and he emphasized, confirmed that fibroids are non-cancerous growths of the smooth muscle of the uterus. He also said that the significant causal factor is hormones. He specified estrogen. But we'll go back on some of our learning. If you have any questions, concerns, my WhatsApp is 0244340437. I'm in the studio with Dr. Paul Enin, consultant obstetrician gynecologist and CEO of the Airport Women's Hospital. Doc, thanks for joining us again.
Thank you.
Great to have you. Now, last week we learned quite a lot. I've tried to hit on some of the key salient things that I recall. But if, we can refresh the memory of our listeners, what is a fibroid?
Well, as we said last week, fibroid is a tumor of the uterus. It's
Right.
originates from the smooth muscle
Right.
in the wall of the uterus.
Okay.
Now, these tumors grow independently. In other words, normally all growths are controlled by hormones.
Okay.
And regulates them. Our eyes grow to a certain level and then it stops.
Okay.
Our ears grow from childhood to a certain size and stops.
Right.
Something is regulating those things. Now, when regulation fails, then individual cells can grow abnormally
Okay.
without control.
Right.
And if it goes to a certain extent where it cannot be controlled, we term it cancerous.
Right.
When it is benign, then it means it can be controlled.
Right.
It grows up to a certain point and it doesn't grow again.
Okay.
Or its growth is so slow
Okay.
that we can comfortably live with it.
Okay. Right. I mentioned last week, and you actually confirmed the statistics I gave out, but roughly we're talking about 1 in 3 women would have fibroids.
That is correct.
And that is not to say that all of them have complications or problems associated with fibroids.
That's correct.
1 in 3 women is quite significant, quite high.
Definitely.
Right. And we sought to understand what would lead the tissue or the cells to grow in this abnormal way.
The truth is that we don't know.
Okay.
But we know what aggravates them, what makes them grow rapidly.
Right.
And we think that the offending organism for offending hormone
Right.
will be estrogen
Right.
for uterine fibroids.
Okay, right. And last week also, I threw in the information that, well, when a woman breaks this, should I say, reproductive cycle, because the same hormone is responsible for her cycle, when she breaks it through pregnancy, she gets, or it confers some kind of protection with regard to fibroids.
That is correct. We've noticed that women who are actively producing don't seem to get fibroid. They may have occasional fibroid here and there, but they don't get a size fibroids to the point where they become very symptomatic.
Okay. Right. 30 minutes past the hour of 2 on Joy 99.7 FM. If you've just joined us, we're recapping and perhaps completing our discussion on fibroids, uterine fibroids with Dr. Paul Enin of the Airport Women's Hospital. If you have any questions, concerns, experiences, share them with us by WhatsApp 0244340437. We're also live on Facebook and YouTube, so you can go to the video feed there and you can actually see us live and follow the program and the discussion. Text messages or WhatsApp is 0244340437. Remember, we come to you kind courtesy of Yumvita, a delicious way to grow. If it's mealtime for baby and you're looking for a healthy, easy to digest infant cereal packed with the essential vitamins and minerals one that has omega-3 to aid in the healthy development of your child's brain, then you choose Yumvita. It comes in 2 delicious flavors, wheat only and a combination of maize and wheat. It's got it all. Yumvita brings you ultimate health and also this discussion on fibroids. So, Doc, we also pinned down the conclusive diagnosis. How does a woman know? How is it confirmed that a woman has fibroids?
Well, usually by pelvic examination and by ultrasound imagery.
Okay.
Now ultrasound is abundant everywhere, so it is the most diagnostic tool available to a physician.
Right. So by ultrasound now, we look into the body, into the uterus, and we can actually detect these growths.
Yes.
Okay.
I must add that, yes, somebody might ask about CT scan and MRI. These are sophisticated diagnostic tools, but they don't add much more to what you can get from ultrasound, pelvic ultrasound, either abdominal or vaginal.
Okay.
Hence, because of cost,
right,
we don't use these as a first line.
All right. So it expands the access to diagnostic, should I say, imaging.
Sure.
Right. If you use the basic, which is, from what you say, adequate.
It's adequate.
Ultrasound. Okay.
Right.
So you confirm the presence of a fibroid or the growths, right? And after that, then what do? Do you now look to pinpoint the rate of development or the stage of the fibroid, or whether it's a problem or not?
Well, basically, once we diagnose a fibroid, we go back to want to know, is it a problem or is it an incidental finding?
Okay.
If it is a problem, the history will suggest the patient herself will complain. I have abnormal menstruation, heavy bleeding, clots, pelvic pain,
right?
Pain associated with the menses,
right,
called dysmenorrhea.
Okay.
Bleeding on intercourse, bleeding intermittently. I mean, there's no pattern to
Last
a
week
woman's bleeding.
you
intermenstrual
labeled
bleeding.
it, yes, intermenstrual or irregular.
Irregular menstrual bleeding, yes.
Right, okay.
So with these symptoms, then of course we'll assess to see how severe the symptoms are. Let me mention here also pain, chronic pelvic pain,
right,
back pain,
right,
also pressure on the bladder, mass effect of the fibroid causing a lot of symptoms.
Right.
These symptoms must be debilitating enough to the patient to warrant then further attention.
Okay.
Significantly, if they're anemic, we need to resolve it. If
Okay.
they're peeing so frequently, particularly at night, that they can't control themselves or they're wetting themselves, something needs to be done.
Right. Okay.
Occasionally, it's because they're trying to get pregnant and it's not happening.
Okay.
And they've been diagnosed with fibroid and therefore they need attention.
Great. So if you just joined us, Doc Enin has just listed in one long sentence several symptomatic presentations that could indicate that you have fibroids. He's also mentioned and underscored that the ultrasound is sufficient and adequate to actually pinpoint, identify and diagnose fibroids. And we also talked about the fact that many of these growths are largely asymptomatic, that the woman has no problem at all. Right. Now, one of the issues that came up last week, Doc, was that many of our callers and texters were suggesting that they've been told they don't really need to worry about it. It's been identified, but it's not a big deal. They found this a bit confusing.
Well, that is true. As I said, if they are not symptomatic, we don't have to do anything because they are benign.
Okay.
You can live with it the rest of your life without any problem.
Right.
If they're presenting you, the individual, with problems, then we need to deal with it.
Okay.
Either infertility or cosmetically, if something is bulging in your stomach,
right,
and you look like somebody who is
you don't like the look
pregnant,
of your tummy.
They don't like the look of your tummy. That's an indication for wanting to do something about it.
Okay.
If you don't want to do something about it, we wouldn't worry about it.
Right.
You don't need to worry about it.
Okay.
But very rarely we worry that a fibroid may have grown fast, may turn into cancer.
Right.
And therefore, that is of concern.
Okay.
But that's very rare, I must say.
Okay. It's rare for a cancer.
For fibroid
to
turn into cancer.
Right.
Because people get concerned because something is growing in their belly and they've seen their belly is protuberant.
Right.
Therefore, they worry.
Okay.
But otherwise, they needn't worry.
Okay.
unless it bothers them.
Right. So your worry will be determined and perhaps informed by a clinical review by a qualified doctor. Last week also, Doc, I asked you whether these things should be investigated, diagnosed, and perhaps even managed by a specialist such as yourself.
Absolutely. However, the generalists are able to handle these cases. If you're anemic, they can resolve anemia.
Okay.
If it's just pain, they may be able to resolve the pain for you.
Right.
Failing these normal treatments,
Right.
they need to refer to a specialist
Okay.
to handle.
Right. I've got Dede from Maryland on the WhatsApp console. How big or sizable should a fibroid be before it can be removed? If it's very tiny, would you bother to do any or undertake any surgical intervention? Is that a criteria for intervention, surgical intervention?
Well, it depends on where it is. The location of the fibroid sometimes determines whether we need to do something about it.
Okay.
If it's inside the cavity of the uterus, it tends to cause bleeding.
Okay.
It will not be asymptomatic. It may also interfere with pregnancy, so we won't consider that asymptomatic.
Right.
You will definitely need to remove it
Right.
before the periods become regular or the person can get pregnant.
Okay.
But in terms of size per se, there is no size beyond which we will say we can't remove.
Okay.
It all depends on the symptoms the patient has. If the person is not symptomatic, we are not worried.
Okay, great stuff. 20 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, brought to you this and every Sunday, 2:05. We're live with all the accurate, up-to-date, unassailable health information. And that's what we're doing right now in the company of Dr. Paul Enin, a consultant obstetrician, gynecologist, several years local and international experience. And he is the CEO of the Airport Women's Hospital. If you know what we call the Aviation Road, I don't believe the name has changed, right?
It's now Kofi Annan.
It's now Kofi Annan Road.
Yes.
Wow. Okay. Right. So opposite what used to be Shangri-La, right? The right turning there.
Yes.
Ghana Home Loans. Yes. It's on the right there. The British will say you can't miss it. That's the Airport Women's Hospital. He also runs the E&E Medical Center in Adenta and, of course, Women 360 Clinic in Adenta as well. Last week, we also established that men are most very, very, very welcome to the Airport Women's Hospital, and there are various specialty services and consultations that go on there. So he's running the steps with us with regard to fibroid. If you have any questions, concerns, you can share them online or by WhatsApp, 0244340437. I've got this. It's from Peter in McCarthy Hill. What are the signs of fibroids and which people does it affect, male or female? This is from Peter in McCarthy Hill. Doc, you want to quickly hit that one?
Well, we're talking about uterine fibroids.
Yeah.
So it affects,
You must have a uterus.
It affects mainly females.
Right. Okay. And he's gone back to signs and symptoms. If we could just run through some of those, the bleeding and other things.
Well, the signs and symptoms essentially are bleeding.
Right.
Irregular menstrual bleeding. By irregular, we mean menses that are painful, bleeding that is heavy with clots, bleeding that is intermittent or irregular,
Okay.
intermenstrual. You can have bleeding throughout the whole month.
Right.
Or bleeding, if there's a fibroid protruding in the vagina, it's called contact bleeding.
Right.
Every time you have intercourse, you will bleed. These are some of the symptoms. Of course, the pressure effect of something growing in the pelvis to the front, it will press on the bladder,
Okay.
and you'll be peeing very frequently, sometimes without even control. You may even leak urine without your ability to control it. And pressing to the back, it can cause, of course, can cause constipation and cause a lot of backache
All right.
to women.
Okay. So those are signs and symptoms, and we've listed them for the, should I say, third time today, but I'm sure we'll get questions in that regard. Before we go to look at intervention, which was where we got stuck last week, these are a couple from last week. Is it safe to decide not to remove a fibroid which is asymptomatic? Are there repercussions for failing to remove it? That's one. Does an active sexual life reduce the risk of getting a fibroid from the age 18 onwards. Interesting. From Yawa, I believe that was. Hello, Norte. I was diagnosed with multiple fibroids, some measuring 8.3 to 6 and 6.3 centimeters. I was told it's extended to my umbilical region. I am asymptomatic, though. Please advise. I think, Esther, we tackled this last week, didn't we? But we can go at it again.
Well, I think it's the fallacy to say that being sexually active protects you from having fibroids.
Okay.
2, the fibroid by a size of 8.3 by 6 point something shouldn't reach the umbilicus. And if it does reach the umbilicus and it doesn't bother you, because it's a tumor. I mean, if you are comfortable with your belly looking as if you're pregnant and you don't want to do anything about it, you're asymptomatic, you don't have heavy menses, it's not causing you pain and pressure, that's fine. For us, you're able to live with it. Okay. That's okay. And it's not growing, it's not getting bigger faster at a fast rate.
Okay.
Then it should be okay.
Right. Okay, then we've tackled the one about sexual activity. There was another one I read out earlier, which was, is it safe to decide not to remove a fibroid which is asymptomatic? I think you've dealt with that.
Yes, it's safe to do that.
Okay, right. Last week, I believe there was one that was sent by Dede in Maryland, which we failed to read out. I'll look for it, and we'll deal with that in a second. Okay, my WhatsApp is going gaga. Naughty, please, I need some advice from the doctor. I was diagnosed with multiple fibroids in March, and the largest measuring... Okay, this is Esther. So she adds more detail. The fibroids were noted intramural and subserous. I was also anemic and I have heavy periods. I was given an iron supplement for the anemia and in preparation for surgery. My blood level is high now and I have headaches every now and then. I think that's blood pressure. But now I don't know whether to go ahead with the surgery. This is from Esther again.
Well, I think that based on the indication of anemia, yes, you probably need the surgery. Being subserous and intramural suggests that it shouldn't be that symptomatic. And therefore, you could have said you don't need surgery.
Okay.
But if it's causing anemia, causing you menorrhagia, which means menstrual pain and cramps and heavy bleeding and becoming anemic, that's an indication right there.
Right. So something needs to be done about it.
It needs to be done.
It is symptomatic.
It is symptomatic.
Right. But, Doc, is there any way you could break down subseral and intramural for our listeners?
Intramural means that the fibroid is inside the wall of the uterus.
Okay.
It doesn't project into the cavity. If it projects into the cavity, we call it submucous.
Okay.
If it projects out of the uterus, it's called subserous.
Okay.
Subserous myomas are not dangerous.
Okay.
Intramural are not.
Okay.
But eventually, by virtue of the size, it becomes very big. Blood is pulled into the uterus to supply the uterus.
Okay.
And therefore, you would have heavy menstrual bleeding.
Okay.
And therefore can become anemic.
So we're emphatic that Esther is describing something which is indeed symptomatic. She's having complications.
Yes.
And she's relating it also to her blood pressure and headaches.
No, it's most unlikely that it will be related.
Right. But
the anemia itself can cause headaches.
Right. Okay. Great stuff. If you just joined us, 28 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, brought to you this and every Sunday, 2:05 by Yumvita, a delicious way to grow. This is also from Dede in Maryland. I asked this question last week, but you didn't get to it. Is it true that fibroids in menopausal women shrink due to lack of blood supply to the fibroids? Is it the reason why doctors advise against removal of fibroids in menopausal women? Dede?
Well, what you've said is true to some degree. Withdrawal of the estrogen hormones in menopausal women makes fibroids not get worse.
Right.
Hence, if at the time of menopause you are comfortable with a fibroid, we don't need to remove it. It's not indicated at all.
Right.
Of course, if you are symptomatic, then that's a different ball game.
Okie dokie. Good afternoon. Thanks for this educative program. You're welcome. That's why we're here. I have irregular menses, sometimes once or twice a year, but constant scan shows no fibroid. I have a child 4 years. I had a child 4 years ago, and I've been trying since. I would like to see the doctor one-on-one. Can I have his contact? Well, I've shown you where his clinic is, both his facilities in Adenta and Airport Women's Hospital. This is from Yaya. She shares that with us. So she's talking of irregular menses, and she talks about once or twice a year. There are women who have this pattern, this presentation?
Yes. I mean, he's having irregular menses for other reasons.
Okay.
And if she comes to the hospital, we'll deal with it for her.
Okay. Right. Hi. Gosh, I've got lots to read. My name is Na from Accra. I've had some irregular bleeding since the end of last year. It started off with 2 weeks intervals and later became continuous bleeding. I have been to 4 different hospitals where I've had different pelvic scans and hormonal tests, and even done a cervical cancer test. And with everything, I've got negative results. Where am I? I have had heavy bleeding with abdominal and back pain, and I've lost track of my cycle. I've also been given iron supplements with different drugs, and the drugs take effect for a short period of time, only for the irregular bleeding to begin again. Last 3 months, for example, I bled continuously for almost a month straight. Please advise. I am 27 years old. Currently, I am with a specialist, but I'm tired of visiting the hospital with no results. Doc, it sounds like a common presentation where you go and come and there are investigations, lab tests, and you seem to get no relief. This is from a 27-year-old. What would you advise?
Well, these are difficult cases that sometimes we encounter. But irregular bleeding doesn't all have to do with fibroids. There may be polyps, growths in the uterine cavity that are not fibroids, that may be difficult to see on routine examination. Ultrasound may not even pick it up. You would think you're okay. I think that somebody needs to do something beyond maybe the test that he's talking about.
All right.
We need probably to look inside the uterine cavity.
Okay.
That we call a hysteroscopy to see if there are any things causing it.
Okay.
The other thing is that the uterus may undergo a condition called adenomyosis and endometriosis, where they have pain, and when you have periods, you bleed into the wall of the cavity of the uterus. Okay. And that will cause a slight distension of the uterus. You may not see any fibroids, but up to you will have irregular bleeding. Okay. You will have painful bleeding.
All right. Great. My listeners will recall that we did an extensive, discussion on endometriosis, and we had a couple of ladies or women affected by the condition in the studio. Rashid Mboku. Rashid Gio Boku, good afternoon. How would you manage fibroid if you don't want to remove it? And how harmful is it if you didn't or don't remove it? Please, can I have the doctor's number? I want to speak to him. I very often, I'm a bit reticent about giving out numbers for various reasons. Ethically, doctors are not allowed or permitted to, in a sense, advertise. So we minimize that. But I've given you the directions. And of course, there's a website for the Women's Hospital as well, right? If you just Google Airport Women's Hospital, you see everything there. Lots of information and contact numbers in the appropriate or on the appropriate platform. Good afternoon, Naughty. I was told I had small fibroids. The doctor said it's nothing to worry about. I had 3 CS, cesarean sections. I have regular menses though heavy. Should I be worried? This is from Lizzie.
No, I wouldn't be worried at all. If you say though heavy, we would want to assess the heaviness through whether you are anemic or not. Okay. The secondary effects. Right. If you are not anemic and you will respond to iron therapy, I think that's enough. Okay.
Great stuff. 33 minutes past the hour of 2 on Joy 99.7 FM. Last week we wanted to hammer a bit more on the surgical interventions and some of the pharmaceutical interventions as well, and hormonal interventions, should I say. I'll take a quick break and a message from my generous sponsors, Yumvita, and then come back. Stick and stay.
Yum, 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 Yumvita. So good for baby, baby. Good for baby, baby. Yum, 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 Yumvita. So good for baby, baby. Good for baby. Mm-hmm. Yum, 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 Yumvita. Yum, 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 Yumvita. Oh, Yumvita. Yumvita, a delicious way to grow. Yum,
Yum. Yumvita, a delicious way to grow, right? If it's mealtime for baby, you need a healthy, easy-to-digest infant cereal packed with essential vitamins and minerals. One that has omega-3 to aid in the healthy development of your child's brain. It's called Yumvita, and it comes in 2 delicious flavors, wheat only and a combination of maize and wheat. It's got it all. Yum, 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 yum. Yumvita. Go grab Yumvita for your baby. Thank you for the advice. This is from the 27-year-old lady. Can the doctor please recommend any specialist where I can get help? Doc, I've given out the location, and of course your specialization is known to our listeners. But let me ask a question in connection with this, and also as a clinical psychologist. Somewhere in there, I sense the frustration. Would a woman like this benefit from some kind of, I don't know whether it's reproductive health counseling plus other forms of counseling?
No, women the whole reproductive system is to have babies.
Right.
So either she's not ready to have babies,
right,
but she has fibroid that she's worried about the future, or she can't have a baby,
right,
and therefore she's concerned,
right.
She needs to see a reproductive specialist.
Right.
And there's so many of us around that it is difficult for me to list them. To list them.
And run the risk of leaving some out.
Yes. But of course, if I were to do it, I'll be plugging in myself.
All right. What I'll do is I'll take your number down, right, and contact you. We've bridged with our resource persons before in, should I say, an ethical and professional way. So we'll get back to you. I can see your number on the screen, and definitely we'll see how we can bridge and get you some help and hopefully some relief. So, Doc, last week you talked a bit about the different types of management or intervention. Can we talk a bit more about them?
Well, let me be dramatic and go for the jugular, so to speak.
Yeah.
The treatment we started with the worst case scenario where we removed the womb completely.
Surgical intervention.
Yes, that put it to rest.
You take out the womb.
Have hysterectomy.
Okay.
That is removing the whole womb.
Right.
Because it is too big. It is too dangerous to do anything else with it. Or else somebody who is close to menopause, somebody is finished having her children who have an extreme symptomatic uterus.
Okay.
You don't need to go and remove the fibroids and let her have repercussions of removing fibroids.
Okay.
So it is easier to remove the whole womb. Hysterectomy.
Okay. Doc, let me just quickly on hysterectomy. In this instance, and from what you just shared, this is a decision you're taking based on the factors you've just listed, but we're still essentially talking about a non-cancerous growth.
Yes.
Right.
Absolutely.
Okay. A lot of people relate hysterectomy and perhaps it's perceived as a drastic intervention because of cancer.
No. Because it's symptomatic, if you do go on and remove fibroids, of course there can be recurrence, there can be side effects also.
Okay.
That complications that we think you don't need to have those complications.
Okay.
If you don't need a uterus to have children.
Right.
Why go through preserving it?
Okay.
So then just remove it.
All right.
In the US, where I spend most of my time, a lot of women with fibroids we do more hysterectomies
Right.
than do myomectomies,
Okay.
which is removing the fibroids.
Right.
So it all depends. Culturally, in Africa, removing fibroids is extremely something that's on thought. Nobody wants to hear.
Okay.
Put it that way.
Right.
So that's why I said it's a dramatic. Let me talk about it and put it aside.
Put it aside.
Then we can go to
Right.
what people are interested in.
Okay, so we've done a kind of something ectomy of that issue. We've cut it and put it aside.
That's right.
All right, Doc. So other than the dramatic hysterectomy, what are the other surgical interventions?
The other surgical interventions would be what we call myomectomy. That is
Right.
removal of the fibroids. And we can remove it by making an incision in the abdomen.
Okay.
Depending on the incision is so important to women.
Okay.
Either we make an up and down incision to your belly button to the pubic line,
Right.
or we make a transverse incision, what we call the bikini,
The bikini cut.
cut.
Right.
which women love to have.
Okay.
But depending on the size,
What fuels this preference? Is it that it's just cosmetically?
Cosmetically.
It looks better.
cosmetically it looks better
Right.
for women. Though for surgeons, it's better the up and down.
Right.
It's better. You have more access.
Okay.
And future, the woman should get pregnant and she would need surgery. It's easier to have access if they have had it up and down
Okay.
than the cosmetic bikini cut myomectomy.
Right.
But most of us, yes, we bow to our patient's preference by doing the...
You just predicted my question because I was going to say this is two men in a studio, but this sounds like a discussion you will have with your clients.
Absolutely. We do have...
What type of cut?
Cut.
Will it show all this?
Absolutely. It's
Whoa.
very, very important to them. So most people will do the up and down.
Right.
Sorry, the bikini cut for
right.
a woman.
Okay. 41 minutes past the hour of 2 on Joy 99.7 FM. I'm going to quickly activate my phone line 0302-216-541. Those of you who want to talk to Dr. Paul Enning, consultant obstetrician gynecologist with the Airport Women's Hospital and also E&E Medical Center and Women 360 in Adenta. 0302-216-541. You get to talk to Doc yourself. Lizzie says she's having symptoms. Her HB is very low, and she gives the figures. I have to take plenty of iron supplements. Sometimes she gets scared. So Lizzie also, I guess, I'll get back to you and see how we can bridge you to care and management. 0302-216-541. Ultimate Health on Joy 99.7 FM. Brought to you by Yumvita, a delicious way to grow. Call us, WhatsApp us, and remember, we're live with Dr. Paul Enning on Facebook and also on YouTube.
99.7 FM.
Right, Doc. So we can do... okay, we have a caller on the line. Hello.
Hello, doctor.
Hello, good afternoon. Your name, please, and where you're calling from.
This is Ajiman Joseph. I'm calling from Community 9, Tema.
Right, Community 9, Tema. Ajiman Joseph.
Yes, sir.
Right, share with us.
Yeah, I think doctor has explained into details about the fibroid. But I remember last week he was making mention of... he made mention of something like we don't have the exact cost of fibroid. So I want to ask, what do our women do? Should they do to avoid this fibroid? And what is the general advice that he has for the ladies, especially those who want to avoid fibroid?
Okay, so you're tipping onto prevention if it's possible. Let me take Kisi in New Ningo if I believe he's still there. Kisi, good afternoon.
Yeah, not a good afternoon.
Right. Are you still in New Ningo?
Yeah, I'm still in Ningo.
Okay. Right. Unofficial MP and mayor.
You see or not?
Right. Share with us.
Thank you very much, and good afternoon to doctor. Thanks for the education. Not ovarian cyst. Is it the same as fibroid? Thank you very much, Nate.
You see, Kisi, last week one bus school, right? But we did this distinction: cyst, ovarian cyst, and fibroid. Doc.
Yes, the fibroid is a hard tumor. It is like stone. inside the wall of the womb.
Right.
A cyst is a collection. Take a balloon and fill it with fluid.
Right.
And put it in the abdomen. You can call that a cyst.
Right.
That's the simplest way.
Okay.
So that should make this distinction.
Okay. Right.
I hope I'm clear.
Right. So the cyst contains fluid.
Yes.
And with the fibroid, we're talking about a solid mass. Right. I have a solid Kwame on my line. Kwame, good afternoon.
Oh, not.
Hello, Kwame.
Yes, not. Can you hear me?
Yes. Where are you calling from?
I'm calling from Dansoman.
Dansoman, please share with us.
Yes. And I want to find out from the doctor. My wife has this fibroid, and the doctor say it is not anything. It's not anything that can prevent her from having a child. But for the past 4 years now, there is no sign of pregnancy, and I don't know why such a thing is happening. And currently, too, she has been discharging from the backside. The doctor says it is not that will have any effect on her. So
okay.
I want to start from the doctor.
Right.
Why this fibroid cannot have effect of having a child, and yet there is no sign of pregnancy.
Okay, but Kwame, I hope you understand that there are other factors that could compromise fertility. Okay?
Yes.
Right. Okay. So that already sets you on one path, but I'll let Doc give a response after I've taken Monica. Hello, Monica. Good afternoon.
Good afternoon.
How are you?
Fine, thank you. And you?
I'm great. Where are you calling from?
Santa Maria.
Santa Maria.
Yes.
Right. It sounds like somewhere in Italy or somewhere. Eh?
Oh, no.
Right.
Not where the bridge collapsed.
Okay, right. Share with us.
If you're 31, you've had 2 miscarriages, early miscarriages, and then a fibroid was discovered and removed. What are your chances? Can the doctor say something?
Wow, you want him to prophesy. Right. 31, couple of a history of miscarriages, and she's had a removal, she says. Yep.
Very early miscarriages. And
early miscarriages.
Yes, and then a fibroid was discovered.
Discovered.
After that, and removed.
And removed.
Yes.
Okay. Right.
Okay.
Well, if the fibroid has been removed, you just have to wait and see. It depends on what kind of fibroid. Fibroids from the back of the uterus, or we call subserous, may not have been the cause of the miscarriage. A fibroid projecting into the cavity, yes, could have been a reason for the miscarriage.
Okay.
A fibroid that was sitting inside the cavity, wholly, could have been the cause of the miscarriage. So if they've been removed, we just have to wait and see if they were the reason for the miscarriages.
Okay.
Otherwise, you may have a subserous fibroid, a fibroid sitting outside the womb, may have nothing to do with the reason for the miscarriage.
Okay.
So having removed fibroid per se doesn't answer all the questions. There are more details that one has to know.
Okay. Kwame was suggesting that, well, he's been told his wife has fibroids. They're not a problem, but 4 years, they're still trying, and she has some discharge, and he's still being told that it is not related to the
Kwame's, I think he did say for 4 years they married without having a child. Yes, it's a problem, but it doesn't have to be due to a fibroid. There are so many other causes of infertility or subfertility that has nothing to do with fibroids. So you would have to get to his reproductive endocrinologist and find out. You never know that, Kwame. It may have been even your sperm count may be low. Who knows?
Right.
So you need to get out.
Get closer.
You need to go with your wife to see a reproductive endocrinologist and let them evaluate both of you and see how quickly we can help you.
Kwame, I hope that helps you. This one says, if the fibroid is small, can you still get pregnant? I'm not married yet, though. Will the baby survive with the fibroid in the womb, but without any health issues?
Absolutely. I don't think you have an issue. If you are asymptomatic at your age, you may have a small fibroid that's not bothering you. You're not trying to get pregnant. So we don't have to worry.
Okay. Right. When a doctor tells you not to worry, sometimes that is when people worry. And that's why we've got a program called Ultimate Health. Listen every Sunday, 2:05, brought to you kind courtesy Yumvita, delicious way to grow. And we've been able to yank into the studio 2 weeks on the trot, Dr. Paul Enning of the Airport Women's Hospital and also the E&E Medical Center and Women 360 Clinic in Adenta, the E&E building. So there's a whole building called the E&E building.
That's correct.
Right. Okay. And so if you need help, and I've also mentioned several times that there's a website. You just Google Airport Women's Hospital. There's a full website with lots and lots of information. In fact, there's even, should I say, a platform, a particular segment for the management of fibroids on the website. I've been on the page, so it's very, very, very educative, very helpful. We can still take a couple more questions, concerns, experiences. 0302-216-541. You get into Ultimate Health, not just a program, but a promise. We promise every week we will deliver and we will answer your questions. And sometimes when we don't exhaust the questions, we are able to, do a little arm wrestling with our resource persons and they come back again willingly. Right, Doc. So myomectomy. Right, you're removing the fibroid. Now, what type of surgery is it? Some are being told, well, you can do it without being cut. You can do it this way. How is the myomectomy done?
That's interesting.
Yeah.
Yes, myomectomy is done, as I told you, as I was saying earlier, from the abdomen. We can cut from the abdomen, bikini cut or up and down cut. The next procedure will be laparoscopic, where we call pinhole surgery.
Right.
We make a small incision below your belly button, create 2 other small incisions, 1 centimeter each, and put long surgical instruments. See your abdomen from a screen,
right,
on a TV screen.
With visual aids, right.
Operate and remove the fibroids from there.
Okay. When you say pinhole, is it literally a pinhole? Is it that small?
Well, it is by the diameter of my pen.
Right.
Yes.
Okay.
They are small incisions.
But
certainly, the technology is relatively new to the country.
Okay.
Therefore, not too many centers are doing it.
Okay.
It is coming in slowly. There will be a day when many more of those surgeries can be done.
Is it available at your place?
It is.
It is? Yes. Okay. Laparoscopy.
Laparoscopic myomectomy.
Myomectomy. Okay.
The other group is also to do with laparoscopy.
Right.
I mean, I'm just teaching.
Yeah.
It's what we call robotic surgery, where it's done by robots. We put it's again laparoscopic.
Right.
It's a type of laparoscopic. That is.
So the clinician is controlling the robot.
From a certain, not even in the room.
Right.
Where
so remote.
Is a remote.
Yeah. Right.
And he operates the fingers of the robots.
Right.
And they do the myomectomy.
Okay.
So a lot of surgical procedures are doing robotic surgery.
Right.
But coming back to fibroids, the next surgical procedure of significance, very significant and relatively minor, is hysteroscopy, where we put the scope inside the woman's womb.
Right.
Through the vagina.
Right.
And remove small fibroids that are inside the cavity of the uterus.
Right.
That is causing heavy bleeding. That is causing difficulty in getting pregnant.
Okay.
That is very, very significant.
Doc, if you could hit on the name again.
Hysteroscopy.
Pteroscopy. And then the removal of the womb is the hysterectomy. Okay.
So this is hysteroscopy. That is looking inside and we resect the fibroids from the vagina.
Okay.
Through, hysteroscopic instruments.
Right, great. Listeners, please note these terms down. Abeku is writing them. We might just do a little quiz and, get to see who's sharp. And maybe if we have something to give away, then I'll ask you hysteroscopy and hysterectomy. Abeku, Quizmaster, note them down. But Doc, let me also ask, this business of freezing, shrinking fibroids, what are we doing when we say we are freezing the fibroids? And then, of course, we've had this ding-dong battle where some say I can take herbal supplements or herbal concoctions to shrink the fibroid.
Well, I mean, the other ones you talk about freezing, or even burning the fibroids.
Right.
If we've done laparoscopy and we've gone, you can actually put electrodes into the fibroids and burn the fibroid.
Right.
Yes.
Burn literally. What you're doing is burning.
Yes.
Right.
But with an electric current.
Okay.
So you can put the needle into various fibroids and burn.
Okay.
And eventually they will shrink.
Okay. And that's the end of them.
That may be the end. They'll go down.
Okay.
They will shrink some.
Right.
So sometimes you want to do something quick.
All right.
Then there is the freezing of a fibroid. Again, through the same system, you can put cryo
Right.
into cold, freeze the fibroid, and they will also
Right.
shrink.
Okay.
And there is, if you are bleeding heavily, there's what we call, again, depends on what the fibroid is doing. Any
Right.
woman who's having a very irregular bleeding,
Okay.
sometimes we stop it by using freezing, using heat. We put hot water into the uterine cavity. We call it thermal choice.
Right.
And that burns the inner lining.
Okay.
And occasionally, after you burn it, they stick together. It's like burning the inside of your mouth. The top part come and stick.
Right.
To
So you have adhesions.
Adhesions.
Right.
But adhesions is beneficial.
Okay.
It doesn't make the woman bleed anymore.
Right.
So, but these are all destructive procedures that
Okay.
I didn't want to talk about.
Okay.
The other one would be surgical that you think about is what we call uterine artery embolization,
Right.
where we put some foam, we trace the vessel that supply
Supply
the
it.
uterus,
Right.
and put some small foamy particles in them,
Right.
and cause blood supply to the whole uterus to be decreased. By doing that, the blood supply to the fibroids are also decreased. So it will start shrinking.
Right.
Very painful procedure, but it does work.
Okay.
And in fact, statistics have shown that myomectomy, the level of shrinkage, the results between myomectomy and uterine artery embolization
Right.
is about same.
Okay.
So why don't we do
Right.
use uterine artery embolization?
Okay.
But if you did, it will also affect your ovaries.
Okay.
The blood supply to your ovaries will be cut down.
Right.
And you might lose the follicles.
Right.
So it's done for people who don't need pregnancy.
Right. So there's some collateral damage. So
It's a major collateral damage.
but if you're speaking specifically about the fibroid, it's effective.
Yes.
Yeah. Okay. But if you're looking to have children,
Then that's not the way to go.
Okie dokie. So, Doc, with all of these surgical interventions, what are the chances of regrowth that the fibroid comes back or the problems come back?
Usually problems don't come back to the degree that you had them before.
Okay.
Very rare.
Right.
But yes, fibroids do recur in some people. But majority of people will have myomectomy once in their
Okay.
lifetime. Few of them would have 2 times or 3 times. But again, as I said, depends on the rate of growth, and it's individualized.
Okay.
So there cannot be one fit for everybody.
Right. So
But
your
the majority
doctor.
of the time, one myomectomy
Okay.
is enough.
Right. Your doctor will make those clinical and diagnostic decisions, and all in your best interest. And of course, from what I've been sharing with Doc in the studio, you have a big say in what is done and how it is done. And that is very, very important. Doc, I've asked about the recurrence of fibroids. Somebody asked a question in terms of, or with regard to what you would tell women. If is there anything they can do to prevent this? Because if it's estrogen driven and it's hormones, and I have those hormones, and when I'm in my reproductive phase, they will be active. Is there really something I can do as a woman to prevent this?
There is nothing that any woman can do to prevent having fibroids.
Okay.
Black women have propensity 2 to 3 times as much as a white person. So what are we going to say? We tend to believe that it is related, it might be related to diet. And therefore, it has been suggested that if you eat a lot of red meat, you tend to have fibroids. If you eat a lot of vegetables, you will decrease chances of fibroids. This is an area I am not an expert in. There's been no scientific studies done accurately to quantify or support either argument.
Okay.
But I can believe that is anecdotal, and it's been said enough that if you eat red meat, it tends to worsen or cause fibroids, and if you avoid it, I'm not vouching for it, but I'm just putting the information out there.
Okay.
You can cross-check it.
Right. Okay. So again, advice to the men, right? Of course, our focus today is on fibroids, uterine fibroids, so women. But we're getting men also calling in to ask questions. I know to a large extent you would love to do some of these consultations with couples if there's an intact couple. But what would you say to men when it comes to fibroids and their understanding and their support?
Yeah, I think that for the men, the general idea is to please support your wives or your women when they do have symptoms suggestive of fibroids. Pelvic pain, peeing frequently, a lot of backache, and possibility, inability to have a baby, or even pain or bleeding during intercourse. You have to be a little patient and understanding and go with the person to the doctor, the gynecologist, to find out what is going on.
Okay.
If it is pregnancy that is delayed, you can also be very sympathetic and understand that it is not only fibroids that can cause infertility, and that there are other issues that can occur that may lead to subfertility.
Okay.
I believe that you should always, this is an opportunity to talk about assisted reproductive technology. In the past, we used to be very limited, but I think that in this day and age,
there's a lot more
reproductive technologies available to assist you if needed.
Okay.
So please consult us. We are available. We've given our numbers. We've given the fertility specialists around that you can consult.
Okay. Great. Many thanks, Dr. Paul Enin, and he is one of those specialists. He's the CEO of the Airport Women's Hospital, a consultant, a specialist obstetrician gynecologist. He also runs the E&E Medical Center and Women 360 in Adenta in the E&E building. Next, we have Sunday Rhythms with Iggy and not Belay. They come up right up after Ultimate Health. Doc, many thanks again for joining us, and we'll be launching a series on alternative reproduction and assisted reproduction, and we hope we'll have you as part of the panel as well. Many thanks, Doc. And we lost Aretha Franklin, so I'll go out on this, and I know Iggy will take it up somewhere. Stick and stay. Many thanks to Abeku San Kofi, who is learning a lot and writing a lot of notes. Stick and stay on Joy 99.7 FM. My name is Naughty by nature. I'm out.
I'm kind of in a hurry. Here's the reason why.